FADIR test for the hip. By the end of this lecture, you should be able to tell what the FADIR test is, when to use it, know what it looks for, and know what are the statistics. Should I use it or should I not? You should also know how to perform the FADIR. FADIR stands for flexion, adduction, and internal rotation. It is also known as the impingement test. It is indicated when the patient complains of pain when in sitting, leaning forward, and exiting a car. Dull or sharp groin pain is going to be what they complain about when it comes to pain. It's designed for impingement, specifically the femoral acetabular impingement, or FAI. Differential diagnoses of this are going to be labral tears, loose bodies, and chondral lesions. To perform this, we'll go into detail a little later in the video. Statistics. So in the Netter's book, they talk about specificity, which is the ability of the test to detect those without the disorder. In this situation is 10%. Not that good. Next, we have sensitivity, which is a test's ability to pick up those who actually have the diagnosis. In this case, is 78, which is okay. It's pretty good. Next, we have inter-rater reliability, which is 58%, which is pretty good. It's mediocre, but it's pretty good. And inter-rater reliability is the ability between two physical therapists, if they perform the test, do they get the same results? Next, we have positive likelihood ratio, which is 0.86. It's not that good because the positive likelihood ratio indicates the probability favoring the existence of a disorder. The higher the number, the better the chances are. Next, we have negative likelihood ratio, which indicates the possibility of an absence of the disorder, and this is 2.3, which you think would be good, but likelihood ratios negative, you want to be below 1. So this, in this situation, is not good. For the research, we have Wilson et al. Evaluation of patient with hip pain. What they did in this situation is they took a bunch of hip tests, they tested them out, found the sensitivity and specificity of each. So for the FADIR, they found that impingement, they found an 88% sensitivity, which is really good. For labral tear, they found it even higher, at 96% to 75% sensitivity. This is based on whether or not it's combined with something or not. For Ensiki et al. With non-arthritic hip joint pain, they did a systematic review through the ICF model for pathology not related to OA, and they discussed the likelihood ratio of each pathology in adults and did a review test measuring hip pain as well as specificity, sensitivity, and reliability of each test. So, for the FADIR, they found a reliability rating of 0.58, which is what we talked about earlier in the previous slide, which is moderately reliable. So that's decent, that's pretty good. For the FADIR, they have a specificity of 78%, which, like we found before, that's pretty good. And the examiner showed 91% agreement, which is inter-rater reliability. So that's really good. For future research, I think they should dive into the validity and reliability for patients with arthritis. I couldn't find an article that actually talked about patients with arthritis and if the FADIR is valid or non-valid based on their findings. In my opinion, at the end of the day, I think that FADIR is a good test. And it's not difficult to implement. It's very quick. You'll see in the next slide how fast it goes by. And I also think that it's good because if you combine it with the FABR, you actually have a very strong case for finding hip pathology, specifically in the articular cartilage or the surfaces of the joint, which is really nice. To perform the FADIR, first start your patient off in supine. Then grab under the heel and under the knee. Flex the leg to 90-90, adduct the hip, and internally rotate with a little bit of overpressure. If there's pain, this is a positive finding. And now a view from the top. Good. Thank you very much, and here are my resources.